Okay, here's the inside of the mink. First we will look at the heart, which is right here. Just kind of smushed, but right now we're looking at the front of the heart. This is the right ventricle, left ventricle. This tiny groove right here is the interventricular groove. These brown spots or these pouches are the auricles. This is the right auricle, and the left one is right there, much smaller. This vein on the top is the cranial vena cava. Back here there is a larger vein that is the caudal vena cava. You have part of the aortic arch. There is red latex coming out of it right there. In the back there are smaller vessels that are blue. Those are the pulmonary arteries. And if you can find the red ones, they are pulmonary veins. Now, looking on the inside of the heart, again, just like before, we always look for the thicker wall for the left ventricle. So this is the left ventricle right here, which is on your right, right ventricle, which is on your left. Inside the left ventricle, there is a bump of muscle. That's the papillary muscle. You can't see the chordae tendineae because of all the latex, but remember the chordae tendineae holds the valves in place. On the right side is your tricuspid. Remember there's an R in the word tricuspid, means right. On the left is the bicuspid. Inside, underneath the auricles, you have the right atrium and the left atrium. They're just inside the auricles. The aortic valve, you would go up through the left ventricle and out the aorta, and that's where you find the aortic valve. And that is the heart, which I will put aside. Now we're going to look at the respiratory system, which has been excised very nicely. You have the trachea, and you have the cartilage rings. You have the right lung, which has a cranial lobe, medial lobe, and a caudal lobe down here. This is the accessory lobe, which you don't need to remember. On the left side you have the cranial lobe and the caudal lobe. As far as the primary bronchus goes, right where the trachea branches off to go to the left and right side, that's your primary bronchus. Your secondary bronchi are the parts that branch off to go into each lobe, so you have 2 on the left side and 4 on the right side. And don't forget that you have the diaphragm, which is the major muscle that separates the abdomen from the thoracic cavity, which has been removed here. Alright, set that aside. Now we're going to talk about our digestive system. We've got the mink mouth, we've got the incisors, which are the front teeth, the canines, which are the really sharp, longer teeth, and you can barely see the tongue sticking out right there. This large thing right here is your liver. Alright, here's the liver that has been removed. Here, this gallbladder has actually been punctured. Yours might be a little bit puffier and green. If you follow the gallbladder down, you got the bile duct. Your liver sits right underneath the diaphragm, right here. The stomach sits right underneath that, which is right here. For some of you, your stomach was huge and full of food. When you opened it up, remember you got the wrinkles, which are the rugae. You also have the spleen, which is quite large in the mink. You have this tissue that looks just like fat that goes from the spleen under the stomach and will attach at the pancreatic duct. That is the pancreas. Many of you removed it when you removed your greater omentum, which was that sheet of tissue and fat that sat over the entire body here. Here we've got the small intestines. The portion right here that tends to be a little bit hardened that comes off of the stomach is the duodenum or duodenum. The middle portion is your jejunum, and the last portion is the ileum. Just read the cue cards. If it says middle portion, you know that's jejunum. First portion, duodenum. Alright. Their large intestine has already been excised, but I can set it in here. This is the descending colon right here, transverse, and ascending. The rectum is further down right here. It's much thicker and usually full of poop. Alright, removing all of that. This is a female. Right here, this hardened pea-sized organ is the bladder. Right here, what I'm holding right here, behind that is the uterus. It's quite small. These are the fallopian tubes right here. They go all the way around to the oviduct, and surrounded in fat is the ovaries right here. And you got them on both sides right here. It's quite fatty. You got the bladder again. And in this tissue, there's a small line. That is the ureter that will run up all the way back here to the kidney, which is actually quite small. And there you got your kidney, which this one has been opened nicely for you. Again, just like before, the medulla is much darker, the cortex is much lighter on the outside, and you can actually see some of the veins and arteries entering into the renal pelvis. That was the kidney, sits right there. Notice the other kidney is completely surrounded by fat, the adipose capsule to hold it in place, and that is our mink.